Hello everyone, welcome to sqadia.com, and in our second section of the lecture topic subfertility we will talk about the causes of subfertility. In the causes of subfertility, we will talk about what are the causes in the females that leads to subfertility, what are the causes in the males that leads to subfertility, and whenever the male and female come or the couples come for the investigation or treatment of subfertility, what are some important points that should be covered in the history taking of the couple. History taking is very important for finding out the cause of the subfertility. So, what are the female factors in causing the subfertility? Is damage to the fallopian tube is very important factor, because if fallopian tubes are the tubes from where the ova from the ovaries come and get fertilized. If the fallopian tubes are damaged, then the ova do not move through the fallopian tube and get fertilized and embedded in the uterus. So without the fallopian tube, without the passage through the fallopian tube, there is no chance of conception or pregnancy. So blockage of or damage to the fallopian tube. The damage can be due to scar formation, damage can be due to previous ectopic pregnancy leading to the damage to the fallopian tubes. All these, or maybe due to some genetic or by birth problem to the fallopian tube, they are twisted, they are blocked. All these cases can lead to infertility. So damage to the fallopian tube is very common factor here. Blockage of the uterine so it can be blocked, there can be adhesions, there can be scarrings, or there can be absence of one fallopian tube after the ectopic pregnancy, in which case the fertility is reduced to 50% because there is only one fallopian tube. Some hormonal problems are also very important factor in female infertility, because if there is no right amount of production of gonadotropic hormones or follicle stimulating hormones, luteinizing hormones, or if the ovaries are not responding to those hormones and do not produce estrogen and progesterone, then the ovulation cannot take place. So hormonal problems is one again very important factor in female infertility. Then cervical issues like any infections. Cervical infections are very common here. You see cervical infections, sexually transmitted infections, cervical cancers. All these are very common causes of the infertility. Infections are common. Then uterine problems like fibroids. These are the fibroids and polyps. They are present in the uterus, and whenever they are present, they can lead to infertility depending on their location and the cause. If they are located in such a way that the embryo cannot be implanted in the uterus, then infertility is possible. Fibroids are the smooth muscle cell tumors or growths. Here, smooth muscle cell growths, fibroids. They can be sometimes so big that they can fill the whole uterus and surgery is required. Polyps are the growths from the mucous membrane. If they are attached by the stalk, they are called pedunculated, otherwise they are sessile. So polyps and fibroids are very important cause of subfertility in the female. And uterine problems by birth, if you see here, this is the uterine septum. Septum is the like a partition or wall. Here, this wall is coming down in the uterus, and if you can see, this is making the uterine cavity very narrow and small. Even in this cavity, it's hard for the growing baby to grow fully. So this is an important cause of infertility also. So all these, and then there is unexplained infertility. As we mentioned in the previous slide, there are about 10% of cases which are unexplained, in which all the investigations are done, everything is done, and doctor don't find any cause what is causing infertility. So that's the unexplained infertility. So common causes in females, very common, hormonal. We have hormonal problems, then we have damage to the fallopian tube, uterine problems, cervical problems. So problem in anywhere in the female reproductive tract can lead to infertility. And these hormonal problems, mainly they affect the ovaries and the ovulation. So this covers the whole female reproductive tract, including the ovaries. Then the male factors that leads to infertility, here if we go on this chart first, there is about 37% is the varicocele. Varicocele is very common cause of infertility, 37%, and that's what varicocele is here. If you see, these are the dilated veins in the scrotum. So varicocele is the dilated veins, and it's very common cause of infertility in the males, 37%. 25% is unknown cause. Then we have 6% is undescended testes. Testes, they do not descend here. These testes do not descend in the scrotum, or they stay in the abdomen. So undescended testes is another important cause of male infertility, because when these testes are not down in the scrotum or they are high in the abdomen, in that high temperature the sperms cannot survive. So the surgery is done to bring the testes down, and it's fixed there to control that problem or treat that problem. Then 6% is obstruction. Here, obstruction of the vas deferens or duct from where the sperms come. So obstruction. Other 7%, testicular failure is 9%, and semen disorders. Semen disorders in which we have low sperm count, sperm mobility is affected. That's also the very common factor in the males. So 37%, most of it, about more than half, is unknown, no cause, and 37 is varicocele. Varicocele are dilated veins in the scrotum here. This is the varicose dilated veins. So varicocele, very common. Genetics also play important role. Low hormone levels, like in females, play an important role, because low hormone levels, low luteinizing hormone, low FSH in males also affect the testes, and testosterone is not produced, which is the hormone responsible for all these characters in the male. So testes are affected. So low hormone is important factor. Some medicines also produce infertility. Azoospermia. Azoospermia is the absence of the sperm. When semen analysis is done, it's find out that there are no sperms in the semen. So azoospermia is a condition in which sperms are absent. It can be due to the blockage when they are not coming down. So different factors can lead to azoospermia. Seminal duct blockage. Seminal duct blockage, here you see obstruction, which causes 6% of the cases of infertility, which is due to duct blockage or obstruction. Antibodies, sometimes antibodies are produced that can destroy the sperms in the male and that can cause infertility. Different infections like sexually transmitted diseases are also very common cause of infertility in the males. So all these factors can lead to infertility in the males. Most common is varicocele, which is the dilated veins, and the unknown cause is the second highest cause. Okay, now we will talk about some points covered in the history of the couple who comes for the subfertility treatment. Age is very important because as the age increases, uh, chances of getting pregnant or conception is decreased because of decreased number of production of ova by the ovaries. So age is very important factor in both males and females. It's important to find out the exact age. Then length of time trying, because natural conception, the time limit to label as subfertile is about 12 months. So failure to conceive after 12 months of trial is labeled as subfertile couple. The length of time is important. If less than 12 months, tell them to go and at least try for to complete the 1 year without any interruption. Any previous pregnancy from any other partner, from any other marriage, that's important. So ask about the any previous pregnancy. Coital frequency is also important because lot of couples, if after 1 year they come and say, oh, we didn't conceive and we tried for 1 year, but coital frequency is very important. The couple should be living together for that whole 1 year and trying for to get conception for whole that 1 year. It's not that 1 month they are together and then 2 months they are not living together. That won't be like 1 year. So 1 year should be living together for at least 1 year. That counts. So coital frequency is important. General gynecological history, if there is any previous gynecological problems, any surgeries, any removal of polyps, any removal of fibroids, any infections, that's also very important. History of menstrual cycle is very important. If they are regular, if they are not regular, if they what's the level of how much amount of blood loss with each cycle, and if it's regular of 28 days or no, that's history is really very important if you do with the history of subfertility. Then history of pelvic inflammatory disease. Pelvic inflammatory disease leads to adhesion formation between the tubes and the uterus, and that can cause infertility. So history of any pelvic inflammatory disease in which there is foul smelling discharge, you can ask them if they had any foul smelling discharge, if they had any fever, if they have any lower abdominal pain with foul smelling discharge. All these are important questions to ask. Previous any surgical surgeries done on the female reproductive system for any for ectopics, for any fibroids, polyps, that's also important. Previous fertility treatment done, if they have ever been to doctor for this problem and what was the treatment done and what was the response, that's very important to ask. Cervical smear history to find out the history of any infections, that's mainly for the infections. If you do the cervical smear, if they had any previous history of infections and they treated for that, that's important. And then pelvic exam to find out any uterine problems, especially like we mentioned earlier, like pelvic uterine septum, if there is any outlet infect problems like fallopian tube blockage problems, all those should be covered if they had history of any pelvic exams, if they had any fibroids, or if they had any uterine abnormalities. In males, history of mumps is very important. Mumps is the enlargement or infection of the parotid gland in males, where there is swelling of the necks. And this mumps is very common cause of male infertility. This causes male infertility. So always ask if they had mumps in the previous past history. If they fathered any pregnancy besides this marriage or this relationship, if they ever had fathered any other pregnancy, that's important to know. Any history of testicular trauma or surgery, and then any history of absence of vas deferens and varicocele. Varicocele cause about 37% of infertility cases, so that's very, very important. And if there was any obstruction or blockage of the vas deferens. So all these questions should be covered in the history of a couple with the infertility. That helps you to reach to the more diagnosis, what's the cause for the infertility, and it helps you to reach the diagnosis. So that was the end of causes of infertility. We talked about male factors, female factors, and some points to cover in the history. Thank you for watching sqadia.com.